Starting Point Coaching and Consulting presents Kairos Conversations, Connecting with Quality, the podcast. Kairos is Greek for the right time, the right season, the right opportunity. This podcast features healthcare quality professionals who share their journeys, their advice, their struggles, how they made that transition into a new and exciting role. My heart's desire is that you find this podcast to be inspirational to you as you make your own journey. Don't forget to share this podcast with your colleagues and friends and rate us on whichever podcast platform you listen to. Thank you for being here. Thank you so much for tuning in today. Today, I am joined by my next guest, Ruth Vo. I am super excited to bring Ruth on today to chat with me so you can hear her journey. I met Ruth actually through a connection on LinkedIn who posted about a career profile assessment for healthcare professionals that Ruth and her sister created. And I was super intrigued by it. I took it myself and y'all, it is spot on. So I wanted to bring Ruth on here to share not only her journey, but the thought process behind this career profile and how it can help you. So thank you so much for being here today, Ruth.
Thank you for having me, Brandy. It's a treat.
I am super excited to talk with you today. So let's start by introducing yourself to the audience.
Right. So I'm Ruth. I'm a dietitian from Sydney, Australia, and I currently founded and started Career Cliniq, a virtual and company supporting health professionals across the world.
There's so much in that I want to get into. But how did you get into being a dietitian? Like, what prompted that, and how long have you been doing that?
Yeah, sure. So I graduated in Australia. We can do two ways. It's either you get the marks to get into an undergrad, an honours undergrad, and then you're fully qualified over 4 years, or you do an undergrad and a master. So I got the marks straight from school and graduated in 2005 and went straight into clinical work. What prompted me to be a dietitian? It was that time around, I was 15, 16, exploring university manuals and how they list all their degrees. And I was one of those students who was quite studious, as I think most health professionals are. And I saw the description. I went through this, and it was for one particular university, the University of Wollongong, just out of Sydney here. And I was going through it, and I even skipped whole faculties because I knew, no, not into that. No. So it was this matter of, I'm not really into all these things, but what am I into? And so I eliminated things to arrive at the Faculty of Health and Behavioural Science. And the biggest attraction to dietetics was how it described this beautiful amalgamation of the pragmatics of helping someone with the craft of knowing something. So health, so intrinsic to happiness and well-being. And there was this really pragmatic way of helping. I'll be honest, unlike many other dietitians, it wasn't food. It wasn't even necessarily nutrition. It was the way of helping that they seemed to describe that attracted me. And I literally put my finger on that, looked at the entry mark that was required and said, I think it was the end of year 10 or maybe early year 11, so the second last year of high school, and said, okay, that's what I'm going to do, whatever it takes. And I'm going to this university. And that's how I got into dietetics.
Awesome. So it sounds like you were pretty focused early on in knowing what you wanted to do. What kind of setting did you work in as a dietitian?
Yeah, it was interesting. I was focused, but incredibly naive in terms of the breadth and even the traditional ways that dietitians might work. So I did my placement in 2 different hospitals, but they were located and governed by the one leadership team. So One of them was in a rehab hospital, and my supervisors just really liked me as a student and the way I worked and saw some capability clearly, and spoke up in a department meeting when there was going to be a locum, like just a 3-month contract that came up. And managers need to fill in the gaps wherever they can, whatever chance they can. And so my supervisor recommended I get employed. And so I finished student placement, prac, on Friday, and I started on the Monday in the hospital in Wollongong. And I didn't predict that. When I was enrolling in dietetics, I pictured, I'll work in a clinic in the outpatient setting. I'll work for myself because that's how you do it, right? And so that sort of thinking of, well, that's how you do it, right, was there quite early. And I didn't expect to work in a hospital. I didn't expect to stay working in a hospital, because I actually ended up staying in hospital work for the next 12 years. And that's not something I expected I would even want to do.
So when did that end, or how did you make that transition from I'm working in a hospital full-time in clinical care as a dietitian to I don't want to do dietetics anymore?
Yeah, so I spent the next 12 years in a few different roles, but one main one was specializing in gastrointestinal surgery. And so becoming a specialist in dietetics is highly sought after, and some roles are quite hard to get. And in Sydney, Australia, I was a public servant, so we work in government hospitals, so it's very secure, relatively well-paid jobs for the hours that are mandatory anyway. There's a lot of credibility working in hospitals still within the profession. It's sort of elevated a little bit. I think that's really shifting, which is good. I think there's importance and dignity and relevance in all roles in each of our health professions. And then I outgrew my clinical specialist role. I was really looking for something more to grow into. And I'd just come back from my second maternity leave, and there was this role that cropped up at a big teaching hospital closer to where I lived, actually. And I thought, oh my gosh, can this be true? It's more senior, it's more education focused, because by this time I'd explored, how do I not be so bored? How do I not be so annoying to my partner, who had his own study to do for his own training? And I decided to enroll in some distance education. It ended up being a master's in health science education. So by this time, of outgrowing my specialist role and outgrowing what the department and the facility could probably provide. I couldn't sink my teeth on it yet, but I knew I had these leanings towards nurturing other professionals, and I wanted to make sure that I was in a position to do it. There's a role came up and I went for it, and I was really encouraged by my then manager. So much support to leave my specialist role and go to this other role, and I got it, and I was so excited. And at the time, I needed to work 4 days a week, quite strict hours. There was obviously no working from home. Do my PhD that I had rolled in a couple of years before. So I had 2 little kids under 3, 4 days of work, a PhD, and other volunteering stuff I was doing for my PhD, and a real desire to sink my teeth into this new culture, this new role, make a difference, learn the ropes, be mentored by my manager, and make an impact in the ways of the practitioners in the department. And it just, the timing was off in terms of the fertile ground for how I wanted to approach work wasn't quite aligned with how I wanted to show up every day. And I think I was realizing the mismatch of where I was at in my season of career and what the workplace was going to offer. And I was realizing the mismatch, the misalignment, and it was eating at me. And And then I would spend days being annoyed that I had low morale because this was so not like me. I loved my work. I loved showing up as a dietitian every day and just felt so grateful. I was one of those people who leapt out of bed to go to work, and so grateful to be able to have those years of feeling that way. So it was a real shock to the system that feeling had gone. And there was this real defining point, Brandy, of getting off the bus of my short commute to work, walking towards the office, and I was walking slowly, feeling pretty down and miserable and annoyed that I was, because I know how that impacts how you show up at work. And it was starting to really impact how I was showing up at work. And then I would just get annoyed at myself for that. Like as if I should be immune to these feelings, And
Yeah.
how dare I, it affect my performance and my interactions. I was being pretty hard on myself, but I was walking from the bus stop towards the office, and I just said to myself, if I could be doing anything different, like if I had that power to change anything right now, what would I change? And the answer that I had to be willing to hear, and that's the thing, you got to be willing to hear the truth of the answer, be real with yourself. It was, I would not be working in this particular role, and I would just be focused on my PhD, because it was getting pretty hard to juggle all those balls. And I don't think I was doing anything particular well, and even that was not sitting well with me. That eats at you, it drains you emotionally, mentally, of not being your best at the different things that you had signed up to. I wanted to be present for my kids. I wanted to finish this PhD. It wasn't a tick box for me, this PhD. I was really aligned with the question of understanding, how do dietitians really think and reason when we approach this task of making clinical decisions? And by doing so, I had to explore the breadth of decision-making science, etc. And I really loved the space and the qualitative nature of the work I was doing. And I heard the answer of, you quit your job and you just do one thing really well, my PhD. And I was like, oh, that's confronting. But I've only been in this role for, I think at that point, it may be 4 or 5 months. And I think, I'm not that person. I've got to make it to 12 months. Come on, Ruth. That looks so bad on your resume. And I was telling myself these, despite being honest with myself about how, well, clearly I needed to do something different, otherwise nothing will change. And so the circumstances are that my boss, who I would have had to have told, and I felt like let down, was about to go away for some long service leave, so have quite a break. So I decided, I'll wait until she gets back, and then I'll have this conversation with her. Probably my one regret, because it was just eating at me for that long, knowing that you know what you should do, but then not acting on it. And eventually I did tell her. I sat her down. I was actually in tears. And I think it's just the realization of, this is exactly what I need to do. I feel so many mixed emotions. I'm not done being a dietitian, but I just need to do less. I need to just focus, zero in on this PhD, and feel like I'm showing up for my special humans in the way that makes me feel aligned with my values. And she was so supportive. That conversation couldn't have gone any better. Tears in my eyes. She sat there saying, I can see this is what you need to do. And she didn't even make me take the whole, 4 weeks that I needed, used, leave that was owed to me, etc. She was just the best human, sitting there supporting me, knowing this is the right thing for me. And I'm so grateful for that. And I felt a weight lift. It was a really big decision. One I could make with my privilege of feeling like I actually am not impacting the welfare of my family by resigning. And so grateful for the support of my husband to just help me make that decision and step into full-time PhD work. But I left without this clear map, but I did leave with a commitment to myself, a really deep commitment that was tested over and over again, I will not jump into anything quickly. I will not act with compulsion to feel like I am moving on to better and greater things. I know exactly what I'm doing because that's exactly how I felt like I needed to act. Like, you give up all this. And for those in my network, it was, wow, isn't Ruth that dietitian who was this specialist and all this? And now she's not. And so all those thoughts swarming around, but I made a deep commitment to myself to become a no person for a while, just so I could do what I left my job for, which was to finish my PhD and finish it well. And I enjoyed the next 2 years thoroughly doing my PhD to immerse myself in the process. There was greater joy. I felt at peace with my decision, and that peace is priceless. I really enjoyed the extra moments. Really, it wasn't about the quantity of time. It was this knowing that I was showing up and really present with my kids and just not feeling like I was juggling. And I felt my body and my mind were able to recuperate and gain rest that I think I hadn't been allowing it with all the things that I was saying yes to. And I got great satisfaction from doing it. It wasn't like I felt forced to do all these extra things. It was like, I really like doing this. This is great. It gives great returns. It helps this person. But it was a real period, those next 2 years, of having no real plan, entertaining some things, but not giving it any more time to explore deeper. And just realize, remember, you are a PhD student. That's a thing you're saying yes to, and say yes fully.
I just really appreciate you sharing all of that, because your transparency and vulnerability and what you shared about, how you struggled with making that decision is what a lot of my audience can relate to, and even myself. And I find that when people get to that point of being tired of what they're doing, but don't know what they want to do next, and they feel like there's a misalignment, but they can't really put their finger on it, that's a very tough place to be.
Yeah, I think all of us want clarity. I think all of us get empowered by clarity, and we're enabled by at least seeing the next few steps ahead. And when we're in a moment where either we're not creating space to get the clarity, or we may have, but we haven't got the tools to create that clarity, the support, the wherewithal, really. And that can be a place of being stuck as well. And I really appreciate those that are in that, and that's a lot of what Career Cliniq is about. It's unlocking, helping health professionals get unstuck across the spectrum of professions and across the spectrum of ways that we work. And I think that's really what prompted me to write a course, which is the Next Step Navigator course. It really is unpacking who are you and what matters to you, even before you go exploring different roles or different ways of working, or different ways of advancing your career. And also stream ahead assessment. Like, I was really prompted by one of the state health systems in our country, who was really trying to tackle the issue of allied health professionals in particular who have so much to give, and that's all health professionals. We sometimes really don't do well at unpacking our capabilities that extend beyond bedside care or patient care or one-on-one care, because we're so conditioned to define who we are by those traditional roles, or those crucial roles that are connected to our title. And so the work that they produced a document that helped, like, just name a few different ways health professionals could evolve. And I read that document and I thought, yeah, this exactly. And I reached out to someone in the system there and said, yeah, we haven't been able to do anything more, but this is just a guide for managers to help people. And I was looking at the work streams and the sentiment of it and thought, yeah, but that's true for all health professionals. And so I decided people need to be able to see possibility. And that was really propped on. How can I take this idea that we can work in multiple work streams, often multiple ones at once, but beyond practice practice and something else, which is often what we naturally evolve to anyway. But the common work stream combinations, at least here in Australia, are, oh, you go become a team leader or a supervisor and then a manager, but you got to wait for those roles to come up. Sometimes they don't come up. And so when you're looking for growth and advancement, then they don't come, so you leave. And we don't need people leaving. We need people aligned. And wherever that is, we need people to stay in hospitals. The patients need happy people who feel like they belong there. And so my absolute North Star with creating Stream Ahead was, if I can just help more health professionals find where they belong next, my job is done. And because if they show up feeling like they belong in that next season, in that next role, can you imagine how they show up for the people they serve, whether it's patients, clients, groups, communities, other leaders? Like, I know that feeling of of showing up, wanting to be there and do your best work. I want others to feel that. And if they need the clarity of what that possibility looks like, how can I help them get that? And so I created Stream Ahead, and I really wanted it to be very easy to use because I know how many things health professionals have on their plate. And I decided on the work streams because I definitely wanted to take it beyond any sort of hospital setting possibility. And I came up with 8 work streams and, went to the literature about, well, what are the key capabilities and profiles of these work streams across healthcare. And I spent time reading the literature about all these capabilities that are either assessed or measured or focused on across all these work streams. And I mapped them, I mined them, I unpacked them, and then I just retrospectively work back into, how do you ask someone whether they are interested in either using that skill or capability, or they're curious about it, or that's already their strengths. Because many a time we're in transitions where we've got all these capabilities that might align with one work stream, but if we're honest with ourselves, we're actually ready to hang up that part. We're actually ready to say, that's been great. Now I actually want to develop a new strength or a new capability. And so I really wanted Stream Ahead to capture both, not just your current strengths, but maybe where your focus needs to be or wants to be. And that was my challenge, and do this in a way that was easy to use and easy to read. And then the report, this personalized report, easy to unpack and take away and be pragmatic with. And it's evolving, and I welcome all feedback because it's certainly a challenge to make it relevant. I knew I wanted to make it global, not Australian. I knew I wanted to make it all health professionals, not just allied health professionals. And there's 22 of those in Australia. I want to be able to hand this to a nurse, to a doctor, an intern, anyone in healthcare, and say, this is the possibility for you. Now, what's the next step after this?
This is resonating. All the things that you are saying are resonating with me so much. And I'll tell you why. As I started coaching clinicians over the years, I realized that when they decided they wanted to leave the bedside, they were so, I'll use the word desperate because I don't have another word, but they just wanted out so bad that they were willing to do anything. And I would encourage them to really take the time to look at their strengths and their skills and those things that they love, to marry those things to find the next role. And when I found out about your assessment and I took it for myself, I said, this is it. This is the thing that I've been wanting to share with my audience. And now I'll share with whoever listens to me about it. But it really does provide a lot of clarity for what could be next, because sometimes we downplay our strengths or the things that are easy for us because we're like, oh, that's easy for us, as if it's easy for everyone.
Yes.
And we downplay what we bring to the table.
Totally agree. I think one of the challenges for many health professionals after interviewing in a project I did last year, one of the biggest challenges was not even being able to see their value and not being able to see a potential path forward. It's about visibility of your own value and visibility of where that connects to a different pathway or the next few steps. And the other challenge to that was, let alone not being able to see what you have to offer, it was the language we need to articulate and express that, but the language we need to identify signposts on the path that are coming. And many people, when we're in our bubbles of what we've been doing for decades and years, even months, and we're maybe looking for the next bit of the way, you need that map, that sort of signpost. Hey, check this out over here. But they didn't even know what to call it. And so a big part of Stream Ahead is I deliberated over the words that I use to describe to make them as universally relevant as possible. And again, bring on the feedback if I can do that even better. But it was about, if I know what something's called or how it's described, now I can go to LinkedIn or to your job search platform, because now I understand the layout of the land. Because when we're in one spot and we're not moving, our vision is limited to only so far. And many would just seek opportunities within that, what I can see. So if we can broaden vision and even get health professionals moving in some direction, this isn't about having those steadfast, in cement goals. I really believe in the power of having a direction, because there's so much discovery along the way. And then you use that information to make your next decision for the next step. And I think if we're honest about even where we've come to today in our careers, that contributes to so much of how we've moved forward. Is if we moved and we got now greater proximity to other roles and opportunities, but staying stationary never broadens our perspective. And I think that's the hardest thing, though, to move. And having clarity about the general direction is so important, because so many will actually move in any direction, as you said. But being honest with ourselves that we are human first and we have lives outside of work, and rightly so, and important that we value those other aspects to our identity. And matching, in my course goes into it, it really goes deep into this, is developing your own personal compass, so that no matter what point you are in your career, it's your personal compass that's navigating you, not the allure of how some job is described, or even the remuneration over there, or the title, or it's you're clear on what should be the conditions of the next role, because you've done the work to understand what matters to me right now. Yes, what are my strengths and what do I have to give? What am I ready to not keep strengthening? What am I going to give up because it's no longer serving me, or it's okay that that's come to an end? Or my constraints and resources, like, hey, I'm a parent, I have caregiving responsibilities and interests, not just duties and responsibilities, but I want to show up in this way for my family. Or I have these bills, I have to contribute this amount of money to our family income or to my personal financial goals. This is a non-negotiable for me. Or I want to work in this way. My best self shows up when I'm asked to work in this way, or I'm focused on this project, or Even purpose, getting clear on purpose, even just your next project-based purpose, where I really want to focus and zoom in on this because I am committed to making this impact or serving this group of people or understanding and advancing the cause in this way. And even I need to work around these types of people. You've worked for ages and you get clear about what gels and what doesn't. And it's like, in my next role, I'm going to be really sussing out culture or leadership or this attitude towards this. Getting clarity on that before you even apply for the next job, I think is powerful and more likely to set you up for a next season that's successful and aligned.
Yeah, so just to provide clarity to the audience, you have a career profile called Stream Ahead Assessment, and that's something that anybody can take, and it tells you lots of different types of fields that you could go into as a healthcare professional. But then you have the Next Step Navigator course that goes deeper into the profile. Is that how it works? How does the Next Step Navigator course?
The Next Step Navigator course, I encourage people to take after Stream Ahead. Stream Ahead will feed into it. It's a 5-step process of really arriving at that next step, that next role, that next decision. But what I found was the decision-making process itself was really hard. It's like there's too many variables, there's too many moving parts. I'm scared. I don't even know what's available. I haven't even started exploring and it feels all too much. I'm not clear on my own compass. I don't have a tool to navigate. Some people do, and this is not for them. I can't even unpack and translate my experience into something that might be useful. I don't even know what I can do. That was a common challenge and thought I heard from people. I don't know what's possible with what I have to give. I've been doing this for 15 years. What could I do differently? And so it's a 5-step process of walking them through the mindset challenges I think we have when we approach change or new, or weighing up the decision of even stopping something in order to start something new, or even helping arrive at, you don't need to leave your job. You need to work out how to optimize where you are. So there's really different types of changes that I walk people through in a self-directed way of arriving at, this is the type of change I need and I'm ready to explore now. So it takes them to being able to finish the course with a next step actions list. And, working through that next step actions list is great to work through with a coach like Brandy. But just with that, I've got momentum now and I've got clarity and I feel enabled. I don't feel stuck anymore, because sometimes the feeling of stuck and overwhelmed makes you do nothing. And it could be a year past and you've still not changed your situation, but you're feeling exactly the same about it.
Yeah, that's what I hear from a lot of people, Ruth, is that the same words they use, they feel stuck, they feel overwhelmed, they don't know what to do next. They get a lot of conflicting advice out there because there are a lot of career coaches, a lot of people who talk about job searches and things like that. Yeah. So there's lots of conflicting information about what to do next. I think people are looking for what's the next step.
Yeah, the course and Stream Ahead are definitely early in the journey. They're not how to write that cover letter. It's not your job search course. There are amazing people out there that work with you on that. This is those steps before the work I think many don't realize they need to do or don't know how to do. And it just jettisons into you a space of, now I'm clear on what support I do. And that's one part of the course, is getting clear on what support you need next. Because you're not meant to do this alone. You don't need to anyway. And when you know what direction you want to know and what you've got to offer, getting aligned support is even easier. And that's something I really encourage in the final step of the course is, okay, let's get clear on what support you need, whether it's on the home front, the professional front. Now seek that out.
Yeah, absolutely. What advice, you've given a lot of advice already, but is there any other advice that you would give to clinicians who are at that breaking point, kind of like when you were going to work and things were starting to feel misaligned and you were frustrated with yourself? What advice would you give the person who is where you were when you were at that point?
Yeah. The advice I would give is you have to create space to sit with your thoughts and feelings, because it's very tempting to ignore them because it prompts action. And then if you're not wanting to act because you feel very insecure and scared about what that might look like, then you often can avoid creating the space to properly think about it. I think many of us can be on a treadmill of achievement, of doing, of being yes, because healthcare will always want yes people because there's so much demand. There's always going to be people that need us. And I think there's a lot of assumptions we can make in that state of flux, in whether you're burnt out or you're approaching burnout, or you just feel so torn between what you wish you could do and what you are doing, and you know something has to change. Those initial steps require brutal honesty with yourself. And I think you can be scared about what you may tell yourself if you create that space. But for myself and for talking to other clinicians and amazing humans who have so much expertise and so much qualification and credibility, it can just feel like, but if I stop or I change, what does that look like in the eyes of others? And I think nothing good can come from making a decision based on how does it look in the eyes of others. And I
Mm-hmm.
know I had to be really real, as not that I made all these decisions for what I did achieve or for the work I did say yes to because it might impress, but it pays off in that way, right? Our reputation, we give, even just thriving off being a helper and helping others grow, get a kick out of that. And if I stop or do less or change course, how will people perceive that? And then realizing that if we keep making decisions based on or strongly influenced by how others perceive us, then it's not going to take us anywhere good. It's not going to take us anywhere sustainable. And we need health professionals that work towards sustainable careers, because healthcare doesn't need more health professionals leaving healthcare. I want to keep them in healthcare, serving our greater purpose, but there's just so many ways to do that. So being honest with what's motivating me or what's behind the fears. So that's self-honesty. You got to be prepared to tackle that. And it's okay to admit, hey, I am actually influenced by what other people think of me. I'm human. I've worked hard for this reputation or the credibility I have or the status that I've gained or the level I got to in this particular setting. So that was one piece of advice, is if you want change and you want better and you want success in new ways, or you just want a breather, be prepared to be misunderstood. I think that's a really, you got to tackle that first, because not everyone's going to understand your decision for change or for different or for stepping back or for new. And if you're putting all your energy into helping other people understand you and your decisions, that's energy you're not investing in clarity, taking the steps you need to, the things that matter to you.
Yeah, I really love your authenticity and think that's why we connected so well
Yeah.
when we met. And I want to say to the audience, check out the Stream Ahead assessment and the Next Step Navigator, which I will put in the show notes section. And I know Ruth said that, she's open to feedback. She's super open to that. But what I want people to also know, what I want you to know as the audience is there have been a couple hundred people who have taken this assessment. So it's not brand new.
No.
And
300, yeah.
Yeah, I mean, I think people would need to understand that it's not this thing that just came up yesterday. There's been 300 people that have taken it, have given amazing feedback already. Which, can you share any of that feedback that you've already received on the assessment?
Yeah, so some people would be like, oh, now I have the words to use now, because the report actually unpacks, in this work stream, jobs might be titled this, or roles might be this, or some people will speak to the accuracy of, oh, now I know how to describe what I'm interested in and how I can remove the noise of the other options. And now I'm clear on just what to focus on. So it was accuracy. It was even the tips or the descriptions of the work streams. And other feedback has been with coaches like yourself, where I'm trying to help people transition. And the work of helping people isolate what they might want to do or the general direction, we have to start with that. And here's worker stream helping my client do that and bring that report to our next chat, to our work together. And it's just a massive complementary tool to make my work as a coach even better and more effective. So that's some of the feedback: accuracy, the language that's used that just helps isolate, ways to keep working towards what you want, and people feeling possibility because it maps it out for you. It doesn't do all the work for you, but it's like, oh, the clouds have cleared now. Now I can see where to head towards.
Well, I can honestly say that I am going to be incorporating this into my coaching practice. So I'm definitely thankful that you created it and that you have shared it with the world. And I'm even more grateful for our conversation. So thank you for joining me on the podcast today.
Thank you for having me, Brandy.
Thank you so much for listening to the show. It would mean a lot if you would share this episode with a friend or a colleague. I would be honored to encourage them in their journey too.